Welcome to Early Intervention Matters, the podcast that helps parents, teachers, and health professionals understand the diagnosis, treatment, care, and support of children with autism, ADHD, Tourette's, and other neurodevelopmental challenges. Your host, Dr. Inyang Takon, is a consultant neurodevelopment pediatrician, and she will provide insight through interviews, answering questions, and breaking down complicated topics. By sharing stories from parents and professionals in the field, we hope to make sense of what can be an overwhelming topic. Early intervention is crucial with children with developmental difficulties. Yes, early intervention matters. And now, here's your host, Dr. Inyang Takon.
Morning, everyone. You're welcome to Early Intervention Matters podcast, and hope you've all had a good week. We're happy to be in another session today discussing topics that are very important for our day-to-day, especially for our children and young people with neurodiversity. So I'm Inyang Takon, I'm your host, and today we've got a very, very special guest who is joining us with a wealth of experience, and we're going to be discussing something that's very topical. We haven't discussed this on our podcast session, so I'm really pleased that we're touching on this today. So I've got Dr. Olasimbo Davidson. Dr. Olasimbo Davidson is a medical doctor and a certified management consultant. She's a distinguished entrepreneur as well, an author. She's a transformational leader. Dr. Davidson has had a wealth of academic experience. She's got a master's in public health, and she also has a PhD in health administration, where she graduated with a distinction. She also has a doctorate in social sciences, so she's well versed and well educated in her field. Apart from her medical studies, she has 2 decades of experience in entrepreneurship, and Dr. Davidson has founded numerous businesses. She's also a strong advocate for women entrepreneurs in Africa. She's very passionate about work in Africa, and she's going to tell us a bit more about her passion and her work in the course of this podcast. She has been a board chair for the African Women's Entrepreneurship Cooperative, and she's contributed to business development across numerous sectors. So we're really pleased to have her. Dr. Davidson, because of her passion, she has also had 10 years of experience evaluating children with learning difficulties. And that's one of the things we'll be talking about. So Dr. Davidson and I were classmates in medical school several years ago. We won't tell you the number. Yes, we were classmates at the University College where we both studied medicine, and we've known ourselves for several years. I've been very impressed with all the work that Dr. Davidson has been doing. So welcome. Thank you so much.
Thank you so much, Dr. Inyang Takon. Thank you.
Thank you. We're talking about learning difficulties today, and our theme for this session is invisible struggles, because most times people don't see people and say, oh, you've got learning difficulties. So you can see someone looking very smart and speaking very well, and people are shocked when they're told, oh, that person has learning difficulties or learning disabilities. So that's why we put out this theme today. It's called Invisible Struggles, Changing the Perspective on Learning Disabilities, because we really want people to not look at this as a stigma, but to be free to approach for help. And that's why we're having this conversation today. So start off by asking Dr. Davidson to, to define what we mean by, learning difficulties or intellectual difficulties. What does that mean? Because once people hear the terminology, oh, you've got learning difficulty, they're like, oh, wow, so that's a no-go. I can't do anything for this child again. Yeah.
Okay, thank you so much, Dr. Inyang. So learning difficulties is not as bad as it sounds. It's really more or less a description of an umbrella range of disorders, but some of them are not even disorders. They're just processing variations. It's like the way the child is processing information is completely different. It doesn't mean it's actually bad. It doesn't mean it's completely deranged. No. So learning difficulties really describes difficulties the child has because of processing differences in their brains. So they have difficulty understanding the alphabets, understanding why the sound and the spelling go together. They have difficulty reading, and it's visual sometimes. They can't put the alphabet together and come up with a word. And so many such, problems are what the child that has an LD normally exhibits. Their brain is completely wired differently. And that's why we call them neurodivergence. So it's not as bad as it sounds.
Oh, thank you. I like the way you explain that. It's the processing difference. And it's not that that child is not going to be able to learn. We just need to know the way that child learns.
Mhm.
And so it's not a sentence to say, oh, because you're not learning in the traditional way. I think that's what usually happens.
Yes,
Everybody is expected to learn in a
the
particular way.
particular way.
And if that's not happening, then people begin to think that that child is completely out of the ways. And you've also explained the fact that it's an umbrella description. It's not specific to one thing. It can
Mhm.
one child may have a different type of
Or a range
learning,
of different types.
a range of different types. Thank you. So parents will want to know what usually causes this, because one of the questions they always wonder is, oh, why is my child having learning difficulties? Or they may have two, three children, one child doesn't
Mhm.
have, or two children don't have. And then they'll
Mhm.
be wondering, why does this child have learning difficulties and others don't?
Yeah, actually, learning difficulties is genetic. It runs in families. I've hardly found a single family that did not have somebody else as part from the child who had some similar symptoms or a different range of LD. Most of them were able to overcome it, but it depends on how severe it is. So usually what we ask the teachers to do is start finding out whether the siblings who are in the same school or the parents ever had some symptoms of this.
Yeah. That's interesting. I remember once being a doctor to a special school here in the UK, and seeing a child from Nigeria,
Mhm.
and the father, despite the child being in a special school, kept saying, why is the child not learning the same things that his sibling is learning? He could not understand it. And he kept on saying, but nobody in my family has this. And I said, you don't know, because these things were not
Mhm.
assessed in that way. But
Mhm.
I'm
Mhm.
sure if you go back, there will be somebody who struggled a bit with things. So the fact that they haven't been given the diagnosis does not
Mhm.
mean there's nobody that has
That's
it.
right. That's
Yeah.
right.
So yes, it's largely genetic, and there's
Mhm.
usually a familial reason, but there are just other things that could happen in early life that could also contribute to the child having learning difficulties, like birth-related
Mhm.
injuries or
Okay.
infections or
Mhm.
things that have
It could be
happened,
acquired. They could be
acquired
acquired.
causes,
Mhm.
genetic
Mhm.
causes.
Mhm.
So for parents to know that it's not something they should be blaming themselves for,
Mhm.
and that's part of what happens when children are referred for assessment. So, just what led to your interest in learning difficulties?
Yeah, good question. I had some learning difficulties, undiagnosed until I got into med school. We did not know what it was, but several of us in our family had it as siblings, different types. And we all thought it was a bit strange, but we didn't know what it was, and nobody diagnosed us. Even in the primary schools we went to international schools. We went to an American school. They didn't diagnose anything. Went to an Egyptian school. No diagnosis. So I think it was just because of the era. It wasn't something people were picking up in school. And our parents did not understand what it was. To them, it was like, you just need to put in more effort, try more. Let's get more lesson teachers. That's what they did. Get more lesson teachers, just basically bombarding us with so-called supports. And I had a variation my sisters didn't have entirely. They had some. My twin brother had some. His was severe in some areas, and mine were completely like a complete range of different ones. Like I found it very difficult to read. I was almost 8 before I could understand how to read. If you tell me, I could get the letters eventually. If you say, what is this? S. What is this? A. N. D. Pronounce this word. No idea. No, I don't know what the word is. So it was a bit difficult because we had no support from anywhere and nobody seemed to know what it was. It was just a matter of laziness, not trying hard enough and all that. So I understand exactly, how it was. And I don't want people to go through this because in some families, the child is an outcast, especially if it's severe. The child is taken out of school and told that, you're not even brainy enough to do any schooling. So the child misses out on essential, education. I know some children have fell out of high school, and that's a cardinal sign. They find it very difficult to pass major exams, whether it's YEC, whether it's GCs, IGCSEs, they fail everything. Or they pass just one or two subjects out of 10. That's typical.
That's just really interesting. And I think what you just said, Dr. Simba, is really powerful because here you are, accomplished, have PhDs, doctorates, doing very well, but just hearing the difficulties that you experienced in early life, people would, like you said, your parents didn't understand it because, and that's what happened in our era growing up. It's like, get them more lessons, get them more lesson teachers, let them read round the clock, buy more books.
Of course, buy more books. My mother became a teacher, a homeschool teacher, and I had a school I was going to. So I was homeschooled, I was in a proper school, I had a lesson teacher. It was like a triple attack. So there was no rest.
Can you imagine? And this is just to give our audience the hope that the fact that your child is struggling now does not mean that child's trajectory is always going to be like that. With the right help, with the right assessments, with the right approach, things can really, really change. And I'm really, really excited about your story because I think this is what early intervention matters aims to do, is to showcase to our audience that there's a way out. It's not doom and gloom for children. If you hadn't persisted and sought help, things would not have changed. When you look back to your early years then, what could have been done differently?
I think at the time I started having problems reading, there should have been some kind of assessment, but there wasn't. I wasn't assessed at all. And then, of course, it became one thing after the other. From not being able to read, I couldn't write. I had severe dysgraphia. Nobody could read my handwriting, not even me. So there were so many signs. I couldn't tell the time. I couldn't tell you what was left or right. I just could not. I couldn't piece together a sentence. I had problems even writing proper essays and things like that. I had audio processing difficulties. So if it's dictating anything, oh my goodness, couldn't write anything you're dictating. So when we got to med school, same problem, but I'd been able to overcome it a bit, but I still couldn't follow the dictation because lectures were dictated. I had some close friends who always lent me their notes. So I scraped through because it took me a while to understand that I'm not the kind of person that can learn by listening. You got to know how you learn. I can't learn by listening. I saw some people who never wrote any notes in our class. They never wrote any notes. They were busy just listening, and that was it. They knew it. That can't happen. I can't learn by that. So I was busy struggling. My sister was busy struggling. And then one day she had a revelation. She just said, don't you think we should go and try some other kind of books? Because we can't understand even the text. I said, yes. What do we do? Let's go and buy illustrated books. So I thought, illustrated books. But Daddy would say that's another amount of expense. Well, how are we going to go about it? Let's just convince him we're not going to pass without those illustrated. So we got the illustrated. They were massive books because everything had to be illustrated. One molecule, you see the nice molecule they drew there. Another molecule plus this molecule is that molecule. Fantastic. That was how me and my sister overcame the molecular problems, the chemistries, the all the physiologies that didn't make any bit of sense. So sometimes that's the first thing you have to realize. If the person has a visual dyslexia, you have got to change the way they learn.
This is just so powerful, so amazing. And as we're talking, there are people who would be listening to this and thinking, oh, this just resonates with me. Because I see this in my clinic when families come and they say, oh, they just struggle to learn and they are just thinking, what can change? What can change? So it's just amazing to hear your story about how you discovered better ways of learning and just applying through medical school and all the studies that you've gone through. How have you done it? Did you get formal assessments in the end?
Yes, so I had to assess myself using online tools. And I realized then that this is what this thing is. I could spell because some people have severe problems with the phonology. They can't spell because the sound doesn't translate in their minds to any alphabetical letters. I could spell. That was the only thing I remember. The math, oh my goodness, because numbers will always be floating in the air. You just can't grasp the numbers. They all seem to jumble themselves up on your page. So coming up to try to pass physics, that was really, really difficult. And of course, we had to all go through prelim. The prelim was what we used to get in. I had to almost kill myself to pass prelim. My dad threatened me with all sorts of things. You had better pass this physics. So it was more like me having assessed myself as an adult. But as a teenager, I didn't really do anything. Like I used to draw. All my notes are in drawing form. So I was like an architect. So if you say, "Can I borrow your notes?" I'll say, "Mm-mm, sorry." What do you mean? I don't write notes. So what exactly do you do? I draw the notes. You can't be serious, right? So they'll see my drawings. I'll draw everything from beginning to end. So there will be hardly any sentence in that text. If I have a sentence, it's just like a couple of words. Everything else is drawing. So it's like, how on earth can anybody read this drawing? It's everywhere. So yeah, it's like, you think it's doodle, right? It's not a doodle. To me, it makes sense. So it's like a very massive, giant doodling, which I turn into my thoughts. You believe me, but that's exactly how I managed to pass.
That must have been so challenging and traumatic for you, just having to go through school. Because when I remember medical school and the intensity and all the things we had to just
It's
factor in,
terrible.
and yeah,
Even
wow.
anatomy. Can you imagine trying to pass anatomy by drawing?
Well done, well done. So becoming a doctor and practicing and doing all that, how did you find that?
I think having managed to scale through med school, the next thing was to try to find out how I would get ahead of the problems I had to do my postgraduate, because I couldn't see myself, with this same problem. So of course, by the time I got to the postgraduate, it was slightly better because I had managed to address some of the issues I had with writing.
Yeah,
So I would not write. They still came to dictate the notes, even in public health. They came to dictate the notes. So I'll just do my little drawing in class. And then I had a friend who always lent me their notes, and I'll convert their notes into my drawing. So I adapted lots of things and tried to match it with some videos, because in our own time, video learning wasn't even a thing.
yeah, it
They would
wasn't.
hardly come to class and project anything. Hardly
Yeah, it
ever.
was just text,
Ever.
text, text, text,
It was
text. Yeah.
text. So I had to look for my own videos, make my drawing notes from the videos. That's how I went through postgraduate as well.
Wow, wow. Honestly, it's just until you actually get into how people have coped with these challenges, you don't know. It's so
Yeah.
interesting.
I mean, people
Yeah.
don't have to do what I did. Some people find it easier to just do audio only. I know some
Yeah.
people who turn all their notes into an audio form. So because they don't have processing disorders, they can listen, but they can't listen as fast as the dictation in the class is going on. So they
Yeah.
record everything in the class, then they replay, and then make their notes in their rooms. So that was another
Yeah.
way some people coped. Don't try to write anything because you can't even go as fast as they try to process the listening.
Yeah. Yeah. Thank you, Dr. Simbo. Just listening to the difficulties that you had to go through. I just remember medical school as being, such a, such a period where you had to take in so much information.
Information,
There were so many subjects you had to
right?
learn, you had to remember. It's just
At
interesting
all.
when I sit back and think back at medical school, and I think in a whole population about how many we were,
Mhm.
everybody was just expected to just do things.
Just
Nobody
get it done.
just get it done. Nobody considered that people were learning differently, people were struggling, and if people were struggling, nobody actually found out why. So it definitely, looking back, we do not want people to go through that
Right.
kind of experience. I think you were lucky that you had siblings that had similar things, so you could discuss with them, you could
Mhm.
chat with them. Even then, you will still have to overcome having to let your parents be involved, because obviously they saw things differently. Our parents did not
Oh yeah, you're not trying hard
understand.
enough. You can't be having a
Yeah,
C. You can't be
yeah,
getting a B. I mean, why did you
yeah,
fail this particular?
yeah. And I remember when you bring your reports home, people are, why did you get this grade?
Mm-hmm.
Nobody thinks
Mm-hmm.
about what was the
What could be?
reason.
Mm-hmm.
Yeah, what could it be?
Yeah.
Yeah. So having worked, you've had the, advantage of being involved with so many projects and working with so many communities. What's been your experience in the way parents, look at learning difficulties?
I think parents are a bit hard on the child, especially African parents. They're a bit hard on the children. And sometimes they are trying to use another yardstick that a child shouldn't have to deal with. So they'll tell you, oh, so person is doing this. so person has managed to get this. But they have this comparing thing they do. And like my grandmother used to say, it's always about somebody with two heads at the end of the day. They don't have two heads. So can you tell me why?
I like the two-head story.
A two-headed story. I used to wonder, but why would you use two heads as a comparison? So I try to tell parents, please, you need to stop comparing your child. That's the first thing.
Yeah,
It doesn't help at all. It's
yeah.
traumatic. You're using somebody else's yardstick. Oh, this person by now should have done this. Look at what other people are doing. You can't use that. And they're not trying to understand the learning thing. How does my child learn? So I
Mm,
always try to educate the parents. Sometimes they don't even believe there's anything wrong. He's just lazy. He's not doing anything. Doesn't study. Why would a child study when he doesn't understand the text? It doesn't make
mm-hmm,
any sense. So they try to impose their own ideas. So he should
mm-hmm.
be doing better. I bought him the best textbooks in town. He has the best lesson teacher. No, no, So they have these fixed ideas about what the child ought to be doing, considering the help they think they're giving him or her.
Yeah, it's true. It's true. Can you, for our non-African audience, I think the two heads analogy is quite. Do you want to expand on that for our
Yeah,
non-African
because it's
audience?
what they believe is, hey, now if a child had two heads, for instance, the child would be super clever. And this super clever child I'm comparing you with does not even have two heads. He has exactly the same one head that you have. And you can't even do as well as him. I mean, how do you explain this? Explain this to me.
That's so true. It's so common in Africa that if that analogy is used. That
Oh,
does
it's
he
very
have
common.
two
Yes,
heads?
it
Yes,
is.
it's very common. And on a serious note, I think that these things can impact emotionally on
Oh,
children
definitely.
when they're
You feel
constantly.
useless, feel worthless, you have no value. And some parents even insult the children, which I must say, please, we have to stop this. Don't call the child names. Don't shout at the child. Don't call the child a dunce, stupid, idiot. All these things don't help at all.
Yes,
Mm.
yes, it can be quite damaging because that child should just feel so worthless when they feel that for something that it's no fault of theirs, it's just the way their brains are processing information and they actually need support from the families
Yes,
as
yes.
well. Is there
Not
anything
condemnation,
else?
not insults, not.
Not exactly, exactly. Is there anything else that um that can influence why parents don't go for?
Yes, I think schools should be doing a lot more. If a school were to identify some cardinal signs and say to the parents, hello, Claire's mom, can I have a word with you? Can you and your husband, can you come for a chat? And then they will tell the parents, we think your child is having this issue. Now, don't panic. It means ABC. Educate the parents first. Now, this is what we advise. Do you mind if we do an assessment on the child? That's what they should do. But you know what I have experienced, especially in this environment, is, oh, no, no, we don't take such children. We don't take children who don't even pass the entrance exam to the school. No, no.
Mm,
And even if we do, by mistake, they scale through, we are going to call the parents and tell them this child does not know anything. This child is unable to learn. You need to withdraw this child from the school. I was horrified when I heard this from a very high end school in Nigeria, telling me that, well, the parents will have to come and withdraw the child. It's going to affect our grade averages. Can't
mm.
afford to have all these issues. Why on earth would you say such a thing? These children need help. You throw them out. How does this help?
Yes, and I think that's a huge, huge problem, particularly where children are being divided by an entrance exam.
Mm-hmm.
And that already the
Everywhere.
child feels I didn't pass that
That's
entrance,
it.
so I'm stupid. The child is already castigating themselves about not being able to do
That's
it.
right.
And then you then have when if they do get in, the schools have low tolerance for them
Mm-mm,
if they're not performing.
mm-mm.
So again, there is a problem with the schools, the teachers
System.
themselves not
Mm-hmm.
being
That's right.
aware.
In a way.
And there's a lot of education to be had. Here in the UK, we
Mm.
do still have some difficulties
Mm-hmm.
with children not being identified at school. And
At
it was
school.
one of the things that enabled us to, myself and my colleagues, to form School Doctor website,
Uh-huh.
because School Doctor bridges that gap between
Yes,
schools, parents, and
that is.
professionals.
And I was a school doctor. So I was able to do quite a lot just observing because
Yeah,
observation is very important. If you can't notice things in your class, that's another problem. You don't notice things. Just think they're errors.
exactly. So there's a lot to be done about training training teachers
Yes.
in Africa, in developing world. How has that
Definitely was.
been? How has that
It's
been?
very tough because it's almost like our teachers don't need training. Uh-oh, why? So they don't even think it's something you need to train people for. So I've been to lots of schools who reluctantly said I could come and train their teachers because they felt it was something they didn't even need. By the time I got
Mm,
into the sections, the teachers themselves were like, "Oh my gosh, we never knew this. I never heard of this before," said one of them. "This exists?" I said, "If you look around your classrooms, you'll find them now because you weren't looking, you weren't seeing. And I want to tell you
mm,
exactly how to find them." So I did some training and it was an eye opener for the teachers who participated. But fortunately, some refused. No, no, don't come and teach her. No, no, no. We are accredited. They hide under this. We are accredited. We don't want the chairman and the management to think we are having an issue. So we don't want to have a training. So there's another political angle to this sometimes.
So these are kind of barriers within schools
Yes,
accepting. But
yes.
how do you think you can overcome that?
I think we should have some sort of Ministry of Education input. If not, the private schools should at least sign up to a program that we are coming up with as experts. Sign up to the program and allow us to educate teachers. At least every biannual session could help because, of course, they keep employing more teachers. So we can't do once a year. The new ones want to know what you've said. So twice a year should do. So we should try and push for something like this. Twice a year, we have a 2-day online session
Mm,
to educate people. We ask them to do some homework. Go to your class and let us have a profile of the children you picked up and let's examine their paperwork, their schoolwork, and
mm-hmm.
let's all discuss and use them as case studies. Then people will start learning what to do.
Yeah. Because
Yeah.
until you screen the children, formally
Yeah,
assess them, you won't pick them up.
you can't pick all
And
of them up just by looking.
mm,
So I had to learn how to screen. I learned how to
mm,
screen. I have I think it's 15 points assessment I created from the standard just to culturally fit with what's acceptable here. And I run those screenings. I take 5 days to run them usually because I don't want to overload the child. Every day we pick something. If it's reading, we have to identify what we call deficiencies. Is a child substituting a word, skipping a word, mispronouncing a word, rereading a word, skipping the sentence completely? All those things are what's called deficiencies.
mm,
And that's reading dyslexia, it's visual.
yeah. So your experience with the schools is that they are not doing those screenings at all.
No, they should do exactly this kind of screening I'm describing. This doesn't take long.
And when you've spoken to other parents about where you've identified the child as having learning problems, what's been their approach? What's been their attitude?
Most of them are sort of like relieved. They suddenly realize it's not something they have to beat the child up for. They realize
Mm,
it's not about withdrawing the child from a school to take the child to somewhere else. Because some of them have changed schools 4 times. A mother told me crying that she changed her child's school 4 times because she thought it was the school's problem, not her son's problem. And the school is just not teaching the child well. Well, she had a point, but changing the child's school every time the child has made some friends doesn't actually work either.
yes,
So most
yeah.
people are relieved, like, you mean this is it? It's just something like this? And we can fix it? Yes, there's something we call accommodation.
Mm,
We have to put in systems that the child can use to learn. If there's there's a school I was talking to recently through the parents because the school didn't want to talk to me directly. And what they said is, "Doctor, thank you so much for identifying these children. We didn't know there was such a problem in our school. But we don't have any projectors, anyone doing PowerPoints. Are you trying to say that we must now invent PowerPoints?"
uh,
And the parents were like, "You have to help my child." So parents, thank God, were pushing for a change in the policy in the school. How the child was going to learn was definitely going to be visual. So they were pushing the principal writing letters. You have to include people who know how to do PowerPoint. You have to buy projectors. You have to send teachers, call them SEND teachers, who know how to help with homework, because homework was a big issue in boarding houses. The child will go to the class, of course, they're not getting anything. Then homework, there's nobody to help, no special person to help. So I told them, tell them, please, we don't mind paying for you to get us a SEND teacher to help with the homework after school. So eventually the school said, okay, I guess we could do something like that, but it's another expense. Are we willing to pay extra? Of course, no. So I find that the schools, they've had so many barriers to changing, so many. But I thank God the parents I've spoken to, they were so relieved. They're ready to push any policy change that would help their children.
that's really, and thank you for the work that you've done in that field because many of these children are highly intelligent children. it would be such a shame for them to be defined
That's right.
by the fact
By
that they've
disability.
struggled with.
Mhm.
Yes, many of them
Yes.
would go on to do great things. I've definitely seen that in the course of my work, that children that
Mhm.
appear to be struggling initially with their learning, they find a way to understand the things they're doing and they then do well and flourish.
Do very well.
Yeah.
Yeah, do very well. Once they can overcome that barrier they had,
Yeah.
they're doing really well.
So right now, we are not having, do we have psychologists that are trained to
Okay.
assess children in schools?
Aha, very good question, because we don't have. At least the schools I've been to, they had a counselor. When I went to the counselor, she didn't know much about it. She thought I was talking about behavioral problems. I said, yes, they may have behavioral problems because they're frustrated children. They may be angry children. They may be aggressive children. They may always be getting into fights because you are a dance. My mom said you are a dance. The children, other children will bully them, call them names. What do you think? The child will be fighting all the time, be miserable all the time. So they do
Mm,
have behavioral problems. So you do need psychologists in schools. You really, really do. But it's not just
yeah.
for correcting behavior that has a root cause. The root cause has to be addressed.
And you've made a very great point by stressing that, because we see lots of children with behavioral challenges. And many times people would think, oh, they're just naughty children. Many of them have difficulties with learning.
Yes.
And until that is addressed,
Mm-hmm.
we will not get to the bottom of it and we will not be able to support
Nope.
them. I do see this in my clinic as well, where a lot of children have been referred with challenging behavior. Sometimes people think they may have ADHD, but they
Mm-hmm.
have learning difficulties that have not been identified. And also to mention that you can have ADHD and have learning
Oh,
difficulties.
yes.
You
I found
know,
a lot of people with combination problems.
yeah, yes,
Combinations. I've seen
yeah,
autism with learning difficulty. I've seen
difficulties.
ADHD with learning difficulty.
Yes,
So they do come in bundles too.
yeah.
Mm-hmm.
So the diagnosis of the child having ADHD or ASD does not mean that the child's learning may not be affected until that
That's
learning
right.
is addressed. This is a
Rest.
key thing for our audience.
Yeah.
If your
Very
child is
important.
having difficulties with learning, if you identify your
Mm-hmm.
child having difficulties with reading, writing, spelling, understanding, processing things, your child may have a learning difficulty, and it's
Yes.
important to get the child assessed. And as we've spoken
Mhm.
today, it does not stop that child from achieving very highly intelligent. And
At all.
your story is so powerful, Dr. Simbo, that you are a highly intelligent, successful doctor today, but you have told us about the challenges you had.
Yes. I still can't write. Yes. We need to get computers for these children if they can't write. Get them tablets, get them computers so they can type their notes.
Yes, yes. So how can parents identify learning difficulties in the young person? What would be those signs that you would, so you're
Okay.
speaking to a group of parents, what would you
Right.
advise them?
I advise them to look for lots of signs. The first one they need to look for is the child failing in school? Usually there's something the child isn't doing well. If they're passing 4 subjects, they're failing 4 subjects. So usually there's those mild ones, but some severe ones, they fail every single subject except maybe one or two. So are their grades dropping dramatically? Those are very cardinal signs. And then when you tell them to read to you, are they having difficulties being fluent reading? They keep making mistakes, can't pronounce the word, or they can't read a sentence without an error. That's cardinal for people who have visual dyslexia. If you say, "Can we have a spelling bee?" You just assess your child. Let's have a spelling bee at home. Spell me furniture. And most children with dyslexia, they spell according to the sound. So they can say furniture, FENITRE. Yeah, because you see, they don't understand how the sounds and the letters are supposed to go together. So they spell phonetically. So that sort of disorder is usually sound disorder. So they have difficulty spelling anything at all. And if you have words with vowels like OUEA, going to have difficulties with that. And of course, there's some that when you give them a math sum to do, they can't figure out maths. They can't tell you multiplication tables. They can't remember lots and lots of things about mathematical problems, how to solve it. These are all cardinal signs usually. Some have combination. Some are okay with the math, but they can't spell. Some are okay with the
Yeah.
spelling, but they can't read. So you have variations. And then, of course, you have the ones that we call rapid naming. When you tell them, I'm going to give you flashcards. Every flashcard, you're going to tell me what it is. So you keep on showing them flashcards. They can't keep up. That is rapid naming problem. Also, when you tell them, okay, I'm going to show you some cards with objects. You just tell me after 10 minutes what objects I showed you. That's memory. Some of them can't remember. And if you say, remember in the sequence I showed you those pictures. No, you've lost them. And if you say, let me try and do a dictation from a very easy book. Janet and John went to the town. He can't keep up with even writing that what you've said. They can't keep up with dictation. So that is where the classroom problem starts, because they can't read instructions. They can't do what you've said. Some of them have difficulty telling the time. And that's because in those days we had the proper clock. So if you use a proper clock and not digital, you will notice what is going on. If you use a proper clock with the two hands, you're going to discover that they can't tell the time. But because it's digital, oh, I know what it is. This is 10:50. So lots of the issues like that are going to crop up, when you're assessing them yourself, just giving them little tasks to do, and you notice the differences. Some people can't write properly because they have what you call reverse writing. They used to call it mirror writing in my time. And mirror writing, when I say, okay, I want you to write B. So the child writes B and then writes 3. So he's got a B and he's got 33 beside the B. So when you say, why did you write 33? E. You see? So he has inverted the E and it's now looking like a 3. And he doesn't know the difference. To him, he's written an E. And he said, no, you didn't write an E. This is a 3. So that's the sort of thing they call reverse writing, which happens in dyslexia. But the way they're processing it, they tend to reverse the letters. So those are the cardinals I could mention off the top of my head.
So parents need to be actively involved.
Oh,
It's not just, they bring the report and you say, work harder, the results are no good. What can we do? Get more teachers, get more books. That's not the
more
way
books,
to go. More
more
lessons.
lessons, more caning.
Okay, that's not the way to go. We really need to look at parents being involved and actually understanding how their child learns and being able to pick up on those signs quite early, and so that they can get help for the child. Yes.
Exactly.
And just from your own experience of looking at this, what are the consequences for delayed identification and diagnosis?
Some of them are really terrible consequences. I know some people whose children don't have any high school certificates today because they could just not understand what to do, and the child decided to drop out of school. And they went to learn something like, I decided to join a factory, or I decided to learn a skill like plumbing. I become a plumber. But that plumber can't actually read anything because he never learned to read. There was a scandalous story about somebody who decided to sue a school because she came out with a degree, but she couldn't read or write.
Wow.
They had decided to put in accommodations which would bypass her learning to read and write. So she came out of school and she found out the workplace doesn't allow that. The workplace still needs you to have basic reading and writing. So she sued the school. So many people come out with very low job skills. So the first thing they're going to discover is the job market is unforgiving, intolerant. They don't want you coming to tell them I had dyslexia. So what? Sorry. It's like you telling them, I want to do this job, but I can't read any single thing. No, go away. So unfortunately, many of them had difficulties getting jobs, difficulties with anything because they couldn't get the qualifications they needed to even get into anywhere. So very severe consequences, very severe.
And of course, the emotional impact on them.
Yeah.
Just
they're embarrassed as adults, can't read. You can't go to the train station and read what it says on the screen. You don't know when your train is coming. You have to keep asking people because you can't read the signboard. You can't go to the airport and read the boards. You don't know when your flight is coming in and when it's because you can't read anything on those boards. That's embarrassing.
And even shops and going to the shops.
Yes, shops, you can't read the labels. You can't read the labels. You can't read anything. So I think it's just unfair to allow people to have such problems later in life. We've got to do the best we can to make sure they get out of school with some qualifications. They just have to, we have to do more, got to do a lot more.
Fantastic. Well, that's just great advice. And just rephrasing what we've been talking about. So we've been talking about, learning difficulties and the different ways in which they present, and that it is possible for children to go through school not being picked up as having difficulties.
Yes.
And that many schools not screening for this. Children either come out as pass or fail, and whereas they would have had interventions if the nature of their
Yes.
difficulties were picked up.
Yes.
From the
Yes.
parent angle is about parents being involved with their child, being able to know how their child learns. So when you pick up on all those symptoms that you have highlighted for us, that parents should begin to think whether the child is having a learning problem. And you can only do that by the parents being involved. So if parents are not involved, you can't pick that up. And also
No.
knowing that there consequences to the child as well. They suffer a lot of bullying at school. You mentioned
Bullying.
earlier.
Yes. Bullying is standard. Once the test results are announced in class, that's it. The person who came last, wow, you're a real dunce, aren't you? Oh my goodness. You're really dafty, aren't you?
Yeah. So, and these are things that harm the child emotionally and can let that child get very frustrated and have behavioral challenges. And also, you made a really good point about people coming out without the basic skills because they'd never been picked up as having problems with their learning and they didn't have the interventions. So it will, you really shared a lot of good advice for families, for schools, and for teachers. That I know the regular teacher training that's done to be a teacher, but actually there needs to be more done about teachers recognizing difficulties with learning at school. Yeah, this has been a great, great session. And we've also touched about how we can identify things in schools. About improving the identification is training the teachers as well
yes.
with basic training. And you're already doing quite a lot of work. I think it's for people to be more receptive, for schools to be more receptive. And I think there needs to be more education in the public. And that's why I was really pleased you could come and share this with us today. Not only for the fact that it's such an important topic, but you are an example of someone who's overcome those challenges. You did a lot of work, and I must say I am super, super impressed and awed by all you did to try and find the way you learn to actually help you go through medical school and excel at it and actually excel in your career. Well done, Dr. Simple. That's an amazing story. And just to show that there are possibilities, there's nothing that stops people achieving. I've seen lots of people who have struggled a lot. And when people identified how they learn, they're fantastic in what they do. I've got friends with learning difficulties who are professionals, clinicians, nurses. I've got lots of them, lots of professional people who've got different forms of learning difficulties, and they span across all professions. So every profession you can find people with learning difficulties who have excelled in what they're doing. And I think that's the message.
Death sentence, not a doom thing.
Exactly.
Nobody's
And
doomed for life just because you have LD.
No. And I like what you said at the beginning, that learning difficulties is a variation in the way your brain is processing information. And that variation is what we need to understand so that we can intervene early. Because the support you got from early on from your family, from your siblings, helped you to both explore ways in which you were learning better. And, knowing about you've all grown up to be very, very successful people in your careers.
My sister's a rheumatologist today.
Exactly. Your sister is a specialist rheumatologist. Your brother is, doing exceptionally well. You have
My twin brother is a chartered accountant.
Can you see? You see, you've all done so well. So thank you so much. And just wondering what your kind of last message for our audience is.
My last message is don't give up on your child. Don't hate the child. Because sometimes the child feels that you don't even like him at all or her at all. And once you start showing dislike for the child, you're frustrated with the child, you're short-tempered with the child would suddenly realize, you don't even like me at all. You don't want me to do better. You just want to get rid of me or something, which is what some people do. getting rid of the child isn't going to be a solution. Oh, you go live with your auntie, I'm tired of you.
Oh.
So we should please, let's be tolerant. Let's try and understand what's going on in the child's life. Let's not put it down to, oh, you're just so lazy, can't be bothered to do your homework. The child is not doing the homework because he doesn't know how to do the homework, can't understand the basics. So many children, even those who I've identified at the level of the 10th grade, we had to go down to grade 2 math, grade 2 spelling, because they'd skipped all those basic fundamentals and they were now high up, close to getting a certificate. Of course, they won't get it with no skills, no proper adaptation. You can't say, oh, you're supposed to be, close to your IGCSEs. What are we going to do now? Don't let the child take the IGCSEs. He's not going to pass it. If it is what you're finding out so close to the exams, let the child realize that you won't be able to get it because we need to go back to fundamentals, algebra, fractions. We have to learn. And that's what I did. I had to tell people that you have to make a story out of everything. For some people, fractions, algebra, the math was just so impossible. So I'm going to invent Mr. Hippopotamus. I'm going to invent Mr. Giraffe. And I'm going to tell you whether Mr. Hippopotamus got half a melon and the other one got the other half of a melon. You've got to get a story into the math for them to remember it because they can't remember it by writing.
Wonderful. Thank you so much, Dr. Simbo. And what are some of the projects you're working on now?
Right now, I'm trying to get a book out to help parents, but I'm just not sure if parents whether they'll be helped, because I just want to explain why we have to assess the children. And if they can do it at home, here is a procedure. That's the kind of book I'm trying to write,
I
like
think
a
that would be
self-help book
very
for parents.
useful. I think that will be really, really useful for families. Yeah. But I think putting out information out there will be useful. Do you have
Okay.
a website or things where people can find your
There's a
work?
website for, no, actually, I don't have a website specifically for LDs. That's an idea I could actually consider right now. I know there's a website I've found for dyslexia. It's a general website. You can download lots of materials to help your child at home. So yeah, there's a website like that.
Yeah. Okay. So if you do have a website for information on the work you're doing, please share it with us so that we can share with our audience. And it's just been amazing having this conversation with you. It's an eye opener, and I think our audience
I
is
hope
really
now.
going. No, it is. I think I think one of the great take home messages from today is the fact that the parents shouldn't give up, just like you said, and the
Yeah.
fact that
No.
the children have had some learning difficulties does not mean that that's the end of their career. It's not a doom, like you said. So that's really great. Thank you so much for all that you've shared.
Thank you, Dr.
Yeah.
Takon. Thank you so much. Nice chatting with you today.
As we always say, early intervention leads to better outcome, and early intervention can only be achieved by early diagnosis. So thank you for listening into the series today. I know some of the things we've talked about today would probably have generated some questions or need to seek clarification. So I'm happy to take questions, and I'll invite you to send your questions to eim@drtakon.com. Thank you for listening in.